Welcome to Insights, brought to you by Manatee Cancer Center. Insights is a multi-series podcast of cancer-related subjects, giving perspectives from specialists and cancer patients as they tell their real-life stories of victory, such as Sharon.
I'm Sharon Blake, a breast cancer survivor. I want to share my story of the most challenging and rewarding journey of my life. I hope you find these podcasts full of wisdom and inspiration.
The complete Insights series may also be viewed at manateecancercenter.com. Welcome once again to Sharon's Insights. This is one of our series of podcasts sponsored by the Manatee Cancer Center. And Sharon's Insights is, of course, Sharon Blake, who's right here beside me. Hi, Sharon.
Hi.
How are you once again?
I'm good, thank you.
Did you have a lovely lunch?
I did.
It was great, wasn't it? I know, I'm so full. You ready for a nap?
Yes.
No, you can't. You have to stay sharp, stay awake here.
Okay.
We're going to be, of course, discussing some other issues as it relates to cancer treatment therapy and friends and family. That's one of the big issues that we're going to talk about today, is being a caregiver, being a friend, and some of the appropriate or inappropriate things that sort of happen sometimes. And maybe you can give some of your insights into things that worked really well through your adventure through this, and also some things that maybe didn't, and some insights into how folks can better handle being a caregiver and being a support to you. Okay. We're joined, of course, also today by Dr. Lou Siegel, who is a retired physician, and we're so appreciative that you're here. You have volumes of experience, Lou, as I understand it, as a caregiver, and obviously many, many decades as a talented internist. Is that correct?
That's correct. And
Okay.
Thank you very much for complimenting me that way.
Absolutely. I actually originally said dashing and debonair off camera, so I wanted to make sure we got that on the on this particular broadcast for you. So
I appreciate that.
thank you, Lou, very much. And also, of course, we have two wonderful medical professionals from the Manatee Cancer Center. To your left is Jody Rollins, and she is a registered nurse. And we also have the fabulous Jill Watkins, who is an MARDT. And tell everyone what that means, Jill.
Medical assistant. I'm also a licensed radiation therapist.
Wonderful. And again, these ladies will be discussing some of the things that they have to face every day, and that other patients have to overcome through their trials and tribulations through this disease. Sharon, I wanted to ask you a little bit about, again, friends and caregivers and things like that, as you originally had faced this, is it about a year and a half ago when you first?
Just over a year.
A little over a year
Yes.
ago. When you first found out about being afflicted in this way, what was the reaction from your friends and family?
Friends were wonderful. I have no family here in Manatee County, but where I work at Manatee Memorial, everybody just pulled together. I even had one of the ICU nurses who'd just gone to case management. She offered her home to me because my doctor wouldn't let me go home. So I left the hospital and went straight to her house for 2 weeks.
Wow.
Yeah, and I didn't know her at all.
Wait, you didn't know her at all?
No, she just moved to case management. She was in ICU for 25 years and I did not know her.
And she said, you're going to come and stay with me.
Yeah, she said, I've just done my bedroom, just done my spare bedroom, I've just painted it. She said, you need to come and stay with me because my cousin lives in Polk County, which is too far.
Right.
So she opened up a home to me.
Aww.
And we laughed.
Aww.
That's what got me through it.
Okay.
I laughed a lot.
Wow.
Yeah.
And now, obviously, having this person, what is her name again?
Karen Moyles.
Karen Moyles.
Yeah.
What an angel she obviously
She is. Yes, she is.
And you laughed a lot. And
Yes.
how important do you feel laughter is when you're dealing with something like this?
For me, it's the thing that got me through it.
Okay.
It really got me through because her mum was there, her brother came over, and when I found out, after the shock of having somebody telling you have cancer, I tried to make it a joke when I would call my brothers in England. I said to them, I'll keep you abreast of the situation. I mean, they didn't appreciate it, but...
Sure. But
no
obviously,
pun intended. Yeah,
Right.
I mean, it kept me laughing and smiling, and I just laughed with them, and they got it in the end.
Right.
So, it was scary, but, because you have no family to hold on to hug. But I had plenty of friends at the hospital, and even some of the doctors were wonderful to me.
Right.
And they weren't even on my case. I had doctors giving me checks.
Huh.
Yeah.
Wow.
Yeah, I had a care package the day before my surgery off one doctor, and she wasn't even on my case.
What was in that care package?
She gave me some breast cancer books. She gave me a Vera Bradley makeup bag. She gave me a Publix card for $500.
Wow. Wow.
Yeah. Yeah.
Wow, what a neat thing. And of course, Dr. Nadaminti and Dr. Kashi.
They've
who
been
you've-
wonderful to me, really
absolutely.
wonderful.
And you also
yes.
had another, your surgeon who originally, you'd mentioned that you'd been...
Dr. Hassan, yeah.
Dr. Hassan
He
as
didn't
well.
even do a copay on me, didn't charge me a cent.
Wow.
No.
That is so encouraging to hear that, you know, in all the significant issues that are going on right now in this country as it relates to healthcare and those kinds of
Yeah.
things, to hear that doctors will really have that
They
the
will.
generosity of spirit and love and
Dr.
things like
Koshi was wonderful as well. I have to say that. She really was.
that. Yeah, she's a wonderful person.
She is, yeah. She's
for
been
you.
really good to me.
So I have to ask you real quick, obviously, as you said, your family, when you would make little jokes and things like that, they were obviously very upset, I'm sure very concerned for your welfare, and kind of thought, okay, Sharon, knock it off, quit with the jokes, this is serious, and you're like, but hey, this is me, and this is...
Yeah, this
so
is-
how did you explain that to them?
I just told them that it was the way I'm getting through it. This is my way of getting through it. I'm not a crier, where somebody told me, you know, you're going to be crying every day, the emotions are going to stir you up. And it was like, I think after 6 weeks, 7 weeks, I cried at work. And one of the nurses said, you're allowed to cry.
Yeah, of
You
course.
know, but I'm not a big crier, and I feel as I'm going to cry now, which is like, oof.
Should I pinch you, or should I just let you cry? Does somebody petition?
No, but you know,
Yeah.
I just get emotional when I think about how everybody was being nice to me.
Sure.
Shit.
Oh, no, it's okay. Well, why don't I
Jill.
move on? The thing you have to understand, obviously, folks, this is obviously a very emotional thing on a lot of different levels, which is why we want to talk about how caregivers and how patients respond to these kinds of things. Dr. Siegel, we're so appreciative of your time in coming here and maybe sharing part of your story. You were an internist for over 40 years in New York, upstate New York,
Right.
and would you mind sharing a little bit of your story with us as far as it relates to being a caregiver and your wife and those kinds of things?
Certainly. Thank you very much.
Thank you.
We came here, like many people, looking to retire. In
Sarasota,
2000
Florida.
Sarasota, Florida.
Okay.
Looking to retire, looking for paradise. And we found it, but very quickly it was paradise lost. We came here in 2006, and in 2007 my wife was diagnosed with multiple myeloma, which is a cancer of the bone marrow. So from one day to the next, you have all the normal expectations of life and living, and the next moment you're really trying to figure out how to preserve your life, and you enter an entirely different world. She entered standard chemotherapy and ultimately stem cell transplant, and it was very difficult. And of course, we were a team. So she was the patient and I was the caregiver. And so we made this journey together. She actually did rather well until 2010 when she developed a second primary cancer, completely unrelated. And a year later passed away. So our life here was centered around her cancer, her illness, and my role as both her husband, as a caregiver, and my role as a physician, though not her doctor, but one who knew enough about healthcare to have to help her in that unique way. So it became both a blessing and a curse for me, having to intercede often because I knew that things perhaps should have been done in one way or another.
Yes.
So one day, the healthcare system and doctors are just sort of over there. The next day, they're your lifeline, your source of hope, your source of everything. And so life changes pretty dramatically. So that's how that period was, one of...
How was the transition for you, Dr. Siegel, from, as you said, being a physician for all that time and dispensing medicine, advice, all those kinds of things, and suddenly being thrust into a different role as a caregiver for someone that is that close to you in your life? What was that transition like for you?
Well, actually, at one moment, I felt like my entire training, education, and experience was meant for that purpose.
Right.
That everything I knew and did had boiled down to trying to keep her out of harm's way and trying to help her. My ability to do that was relatively limited because I couldn't function as her physician, but very often I would have to answer questions for her that I knew that she wasn't answering correctly, because as a patient you answer them one way, and I know what doctors are wanting to know.
Can you give us an example of what you mean by that?
Absolutely. Sometimes in the process of accessing care, doctors or healthcare providers who mean well and are important, and to be a good patient and to be a good caregiver is to have a collaborative role with them.
Okay.
But as much as you need their help, they need your help too in order to make the encounters productive. But sometimes questions aren't asked correctly. For example, they might say, ask a question with an answer. You're not having any pain today. Instead of asking, tell me how you feel. And my wife would say, no, I'm not. But I would have to say, well, she doesn't experience pain. She experiences discomfort, ache, which is an entirely different set of feelings.
Right.
They sometimes would say, are you still taking the same medications? And my wife would say, yes. But I knew that if and when I did say, may I see the sheets of her meds, I would see that, well, she's never been on that one, and that one was stopped a month ago, and the dose was changed here. So there was a layer of vigilance on my part. I couldn't rest.
Right.
I had to make sure that the process worked efficiently for her, which I, as a physician, knew was going to happen, but she, as a patient, really could never tell. So, and then there's the lost in translation, the medical lingo that sometimes is used, which is understandable, but for the caregiver, one not a physician, and the patient might not be understandable at all. So
For sure.
sometimes I would have to say, could you say that in a different way? Could you explain that in terms my wife could understand? But it went on and on. So in a way, I assumed the role of her medical provider, but without actually delivering medical care.
Gotcha. Okay. Now, for you two ladies, dealing with day-to-day, and by the way, we're sponsored here by the Manatee Cancer Center, which of both of you ladies are work there. And do you see what the kinds of things Dr. Siegel is speaking about quite a lot, as far as both the patient's maybe lack of understanding of terminology and communication breakdowns in terms of understanding things or treatments and those kinds of things? Jill, you want to address that real quick?
Yeah, absolutely, we do. I mean, we always recommend that a patient comes in with a second set of ears at least, and take notes, because they, especially with the first news of diagnosis, they have so much. They haven't even absorbed that yet.
Yes.
They have so much information coming at them, either it's from medical oncology, radiation oncology, their surgeon. It's just really hard. And providing. I don't know, Jody, maybe you can kind of jump in here.
Well, I think you don't hear half of what's going on around you. You're so shell-shocked, and you're cancer, this big, bad, horrible word, and people don't hear it all. And to have another set of ears is absolutely, we recommend people do that, and we actually give them a pad and paper to take notes.
That's great.
It's important.
Absolutely. And are there, at Manatee Cancer Center, are there support groups to assist the caregivers as well as the patients in terms of, again, better understanding maybe what the processes are and what needs to happen? I mean, do you handle that, or is there another area?
There
of
is.
the
I mean, we
hospital
do for sure. We have the Cancer for Building Hope here out in Lakewood Ranch. It's an unbelievable facility.
Right.
If you haven't been there, you have to go, even just look at it.
Right.
And you can just imagine the wonderful care that happens inside. There is support groups. They have groups that are done separately with the caregiver and separately with the the patient, and they have combined groups too, and they can be tremendous help to people going through this, this time in their lives.
I bet, and it's interesting you say that. It's a wonderful organization, as you said. If you ever get a chance to be there at Lakewood Ranch,
it's incredible.
Wonderful facility. Now, you made a great point just now about how there are support groups maybe for just the caregivers, because maybe there are times where the caregiver needs to vent or to say, I don't understand, or this is the person they've been this way their whole life. Now they're suddenly rocked by this potentially devastating illness, and they're not the same person anymore, don't behave the same, don't respond the same way, and so you have a separate area for caregivers as well.
Correct. And there is a website, cancerforbuildinghope.com.
Okay.
And they have all the information, all the different classes on the website.
Okay. Well, that's wonderful. Well,
and I think it's .org. I
it is
apologize.
.org, I believe. I think you're correct about that.
Cancerforbuildinghope.org.
No, it's not. No, it's not.
Okay, help me.
It's centerforbuildinghope.org.
Thank you.
Yes.
We'll get that right.
That's right. We'll get it right, and we'll repeat that several times for everybody. I'll tell you what, with that, we're going to take just a brief moment, and when we get back, we're going to discuss, again, being a caregiver and those kinds of issues a little bit more. We'll be right back. To our podcast of Sharon's Insights about dealing with issues of cancer, sponsored by the Manatee Cancer Center. When we were just on our little break, we mentioned this thing about an apple a day, and laughter is the best medicine.
Yes.
What are your thoughts on apples first?
They're okay.
They're okay. What is your favorite kind of apple?
I like a gala.
I love a gala. I'm kind of more partial to a Fuji, but a gala is a pretty close second.
Yeah.
Fantastic.
Yeah.
All right. Dr. Siegel, what is your favorite kind of apple?
I'm a Macintosh person.
Are you?
Actually, yes.
They're probably from Rochester, right?
Since before childbirth, actually.
Is that right? Tell us all about that.
Maybe later.
Maybe after the podcast. And ladies, we did mention about laughter being the best medicine. And in your experiences over at the Manatee Cancer Center, how prevalent and how true is that statement, or maybe no truer statement has ever been made? What do you think, Jody?
I know. Well,
Or Jill?
go ahead.
Please, Jill.
Oh, I know at our East Center, I always try to keep things as light as possible. I mean, you got to take into consideration the seriousness of someone's illness.
Right.
But, a patient comes in every day for treatment. We see them 5 days a week,
Right.
Monday through Friday, for sometimes as many as 9 weeks. So, they don't want to come in to see doom and gloom, and everyone's, so we can make, as many lighthearted comments and jokes and stuff. I think it helps them get through, and I think patients really appreciate that.
I'm certain, and again, at your facility, I'm quite sure that the level of professionalism and care and that kind of loving attitude is really, as you said, what gets people through. I mean, so much of it is, of course, the physical treatment itself. But tell us a little bit about that, Jody, how important it is as a caregiver, both at the professional level like you do it, and also for the caregiver at home in terms of the things beyond the physical.
Yeah, I got to say, I think it's just as important. It's the emotional aspect of it all is, it's so up in the forefront. You can see the reactions, with medicines and different things, but, the emotional aspect is just, it's so up there. And I do think laughter is the best medicine. I mean, I get a kick out of, I like to whistle at all the guys in their gowns. I walk down the hall and you see a little rear end hanging out. And they think that's the best thing ever.
Absolutely, for sure.
And they come in, I get hello gorgeous, I say hello handsome, and
nice.
It's wonderful, and people look forward to it.
Yeah.
And sometimes that's all people have, is to look forward to a little funny comment or a hug every morning. I get hugs, I get kisses. It's a beautiful thing. It's a very rewarding and challenging, but you get so much out of it. It's worth every bit of it.
Well, now, Dr. Siegel, one of the things that is very important as a consideration for being a caregiver, so often it's characterized as being a burden, or being something that, now you've altered my life in such a way, and I think it can be characterized that way. What are your thoughts about being a caregiver as it relates to your life or other people's?
Well, I think it's important for the patient to know that they are not a burden to the caregiver, And it's important for the caregiver to know that it's a rare opportunity in their life to provide care, comfort, love, reassurance, and actual needs for someone they love.
Yeah.
And though it is hard work, it's hard work to be a patient, it's hard work to be a caregiver, but there is a very positive aspect to it because you and you alone are providing all the essential needs of someone who is suffering. And that opportunity doesn't come along, although no one would like to have that opportunity. It is an opportunity. So it's important for someone to raise that to the level of consciousness for both the patient and the caregiver. The other thing I think is important is that we're not trained to be patients and we're not trained to be caregivers, and we sort of wing it. Every day is a different day and we have to make decisions. And for me, as a physician, I knew that in seeing 30 people a day and in 15 minutes having to decide, why are they here? Are they really sick? What do I need to do to figure this out? What am I going to do about it? And go on to the next patient, that I couldn't possibly be right 100%.
Right.
But I convinced myself that I was right at that moment because I made my decisions based on what I knew then.
Right.
As a caregiver, you're faced with those same kinds of decisions. Am I following the instructions correctly? Am I asking the right questions of the doctor? Did I do the right thing by doing this? And self-doubt can't play a role in being an effective caregiver. You have to have the attitude that what you're doing at this moment is the right decision and the right choice based on what you know at that moment.
Right.
And though you may learn something different down the road, at the time you did it, it was the correct decision. So feeling comfortable in that role is important. And I think I had that sense about it because of my role as a physician, but I think a layperson might not have that opportunity to be told that what they're doing is good and okay, and they'll be good caregivers.
Right. And how important, for both Jody and Jill, whoever would like to take it first, how important is it as professionals to support and encourage caregivers in that way of saying, you're doing a good job, or nurturing them in a way and saying, maybe you're doing this but could be doing something a little bit differently without being chastising or something, because again, it is such a difficult thing. And as Dr. Siegel said, you're never trained to be a caregiver in the way that, let's say, you ladies have the background and training in it. So what kinds of things do you tell a caregiver?
Well, and the thing is we treat the caregiver just like we treat the patient a lot of time. You know, you have, these people coming in with their loved ones who are going through difficult times. And yes, the patients be treated, they may be back, getting their treatment at the time, and the caregiver comes to you and says, I need some help. So you have to help them along and say, you are doing a great job. You're helping them emotionally and physically, and and so they need that. They need to hear you're doing a great job. And that's a wonderful thing to be able to do that for people.
Sure. What do you think, Jill?
Jody pretty much hit it on the head. I mean, if sometimes their level of support kind of goes beyond us, if they need other additional resources. So, that's when we're referring them to the Center for Building Hope.org or American Cancer Society. If they need help with transportation, getting their loved one to and from
treatments and things like that.
Yeah.
That's wonderful. So, all right, for you, Miss Sharon, what was your experience in caregivers? Were there moments that worked really great, and other moments where you thought, wow, that could have been handled differently? What has your experience been like in terms of how you've been taken care of by people around you, both professionally and otherwise?
The professional side, all my doctors have been wonderful, and then the girls at the centres when I went for chemo and then radiation. I mean, we used to laugh every time I walked through the door. Personally, though, because I stayed with a friend for 2 weeks, then I went home and I looked after myself. My niece Alex came over from England for 2 weeks, and I left England when she was 11 days old.
So she didn't even know you?
No, not really.
I mean, not on a personal basis, right?
So, sorry.
That's perfectly fine. So you actually sort of took on the role of being the patient and the caregiver.
Mm-hmm. She came over for 2 weeks, and then 2 weeks later I went back to work.
Right, and then luckily you had these great people you worked with at Manatee Memorial Hospital.
They would change my dressings for me at work in the bathroom.
Wow.
Some of the nurses, because I couldn't get to it.
Right, sure.
So, they've seen more of me than I've seen.
well, nothing like closeness at work, you know.
Yeah, but they were really good to me after I went back to work. And I'd never worked with these people before because I moved jobs when I went back to work.
Right, okay.
So I'd never worked with these nurses before, but they all helped me change my dressing every day.
Wow.
I've been truly blessed.
You really well, and I think everybody that comes in contact with you is blessed with what a lovely person that you are, and I just can't imagine meeting a nicer person than you. You're really,
thank you.
Really, really lovely person, Sharon. And so now for you, Dr. Siegel, as do you have any insights as far as what final thoughts on like what people can do if they are faced with this? As you said, one minute you're just kind of living your life, the next minute life changes, and then it's about survival. Do you have any suggestions or recommendations for how folks can approach things?
First, I'd like to say I think it's interesting to hear from Sharon that my assumption was that there's always two of you, a patient and a caregiver, but that's not always the case.
No.
And it's a thought that's so important that you may be alone. You may be the patient and the caregiver at the same time.
Yes.
Which means there's an extra level of need that person has to be provided and has to be in the equation to help that person along. Mm-hmm. The other thing is that when there are two people, there are two stories going on. Whether humor is appropriate or not has to do with whether that patient is receptive to that. And then the need of the caregiver, which is often minimized compared to the needs of the patient. So it's very complex. Mm-hmm. All patients aren't the same for the same diagnosis. All caregivers aren't the same. Their abilities are different. We talk about cancer survivors. I talk a little bit about caregiver survivors. The process has to work for that person as well.
For sure, and actually it's great that you mentioned about the Center for Building Hope. There are patient groups and caregiver groups that meet both at the same time and separately as well. I know that there's Wednesdays at 6 p.m. at this point and Thursdays at 1 p.m. It is listed on their website, centerforbuildinghope.org. It is listed under, quote, the hearts of our programs, support groups on the Center for Building Hope website. So just remember, if you ever go to the website, that you can look under the hearts of our programs and find that. And there's 3 different ones. There's one for all breast cancer survivors, there's one for advanced breast cancer, and then there's Survivor Rock for women diagnosed in their 20s, 30s, and 40s. It's very comprehensive. It's a wonderful facility here again in Manatee County, excellent. Or Sarasota County, I guess technically Sarasota County, Florida. Really, really wonderful. Jody and Jill, I want to get some last thoughts from you as far as going forward. Any little insights that you can give in terms of either being a good patient, a good caregiver, and those kinds of things?
Well, I think one of the most important things, and I think Dr. Siegel said it very nicely, is when you are able to be with someone during a time like this, it is a privilege, and it's an honor. And I think we forget that, and I think the cancer word, can be such a horrible word for a family, and it cascades around neighborhoods. Mm-hmm. But it is an honor to be able to help somebody going through this time. It's truly an honor, and I wouldn't change that. And unfortunately, the outcome's not always great.
Yeah.
But to be able to be there and get a thank you and a hug from somebody going through this I feel like $1 million every day.
Right.
Sure thing. Mm-hmm.
Absolutely. Jill, anything you want to echo with that? That's your feeling on it too? Okay. Well, I know this has been a kind of a difficult and emotional broadcast here, of course, sponsored by the Manatee Cancer Center. If you have any other questions and you want to contact Manatee Cancer Center, do you know their contact information? Manatee Cancer Center.
ManateeCancerCenter.com is our website.
Okay.
And there are links from there that will bring you to all different areas and resources.
Sure. And so one final thought, apples. Are you sure? Macintosh? And
Well,
what's
now
your
I'm
favorite?
not so sure.
Now you're not so sure, right? No, I mentioned, you mentioned something about compatibility. If you like Macintosh and she likes, maybe that there's no
Well, the way
compatibility.
she says gala makes it sound so great.
Well, it is a gala after all, right? It's kind of fun.
Yeah.
It is a gala.
How about an apple without a worm?
An apple without a worm, that's
There we
always
go.
nice. Give that to the teacher. What's your favorite apple there, Jim?
I'm an ambrosia girl.
Ambrosia, very nice. I thought somebody would be a pink lady. I don't know. They are really good, aren't they? Anyway, we thank you all for being here and sharing your stories with us, and please continued success and love and happiness in your lives. And we'll look forward to seeing you on a future podcast. This is Mike Cradlick saying thank you very much and have a wonderful day. Thank you for listening to Insights, produced by the Manatee Cancer Center. For more information on upcoming podcasts, visit www.manateecancercenter.com.